Our next presentation is about the wartime challenges for civilian ophthalmologists. The presentation is going to be by Kolomiyets. Hello, dear colleague. I am going to speak on wartime challenges for civilian ophthalmologists, and I will be speaking of the challenges we are facing. Any doctor can find themselves in a situation when we will have to treat the patient with the acute trauma. And so, for instance, there is case-evac and medevac. Case-evac are the vehicles not protected by Geneva Convention, and they are used in extreme cases. And medevac is equipped with medical equipment, and it has medical professionals on board. According to the Geneva Conventions, they are also protected. And these are the stages of evacuation. There is a stabilization point with the main task to stop the bleeding and immobilize the patient. Role 2 is the damage control surgery stage with the basic lab and instrumental testing. Role 3 are civilian multipurpose hospitals, where the broad spectrum of different interventions are provided, and at this stage the civilian ophthalmologists are participating. Role 4 are specialized facilities outside of the combat areas. This is where we provide rehabilitation and bring back patients to civilian life. And all of this works only in case of structured military evacuation. In case of mass challenges, the situation is much worse. The case-evac and medevac are delivering the patients to specialized hospitals, and we have a chance to provide ophthalmological care. The ophthalmologists have to provide a timely diagnosis and define the steps of care. In combat conditions, we are always relying on the hierarchy of priorities. We are saving life, we are saving limbs, and only then we are saving the vision. It all started from the Navy, but later was probably applied in the military conditions. We are relying on the minimal safe interventions until the full specialized care can be provided. In conscious patients, we can start from checking vision acuity, we can examine the eye, and we can use computer topography, or if not available, we can use the Colton-Baltin X-ray. And we can also ask a lot by asking the patient, is everything okay with their eyesight, if they can see the hand movement, the fingers, etc. But the vision acuity table is not useful in combat conditions. And here we can do some general examination of the eyeball. Sometimes we can take photos to get additional consultations. All the rest depends on the skills of the doctors that are treating the patients in civilian hospitals in wartime. Ultrasound is a very important method, and in standard conditions we use high-definition sensors, but If such equipment is absent during the war, we can use the regular multi-frequency sensor. This way, we are able to identify the detachment of retina, the presence of external objects. Here is an example of the detachment of retina, and there are membranes that can be found in the form of the cupola, and there is a hemophthalm with low dispersion inclusion that are moving with the movement of the eye. This is the luxation of the lens, so we can see it as a clear structure of typical position. There are external objects with specific edges with some acoustic artifacts. And this is the orbit city, which is the golden standards enabling to identify external objects and assess the comorbidities. And this is why we recommend CT to every patient with such signs and symptoms. The signs of penetrating injuries are the presence of air and external objects in the eye. This is what we can see in the city. We see low density areas of black color that are contrasting with the rest of the structures. The deformation of the eye contour is present as some differences in the eyeball configuration. It can be squeezed, it can have uneven edges, and these are external bodies that we can see on the CT. And we can also assess their position compared to the other structures, such as the eyeball walls. This is the luxation of the lens. This is a suprachoroidal hemorrhage. You can see that the dense wall of the eye, and there is the total destruction of the eyeball with the destruction of the normal anatomic form of the eye. And the Comberg-Baltin X-ray diagnosis is an accessible method that can be used in the conditions when CT is not available. Its accuracy is lower, but this is more or less how it looks like. And now a few words about the care we can provide in penetrating injuries. We wash the eye, we minimize manipulation with the eye, we do not use any local treatment. We can apply the eye patch, this is an example. And we then prescribe antibiotics. So this is how the eye would look like if we do not wash them properly. Thank you for your attention. Glory to Ukraine. Thank you so much.